This video aims to explain basic medical concepts regarding the coronavirus and the COVID-19 pandemic. It does not contain any therapeutic nor material advice. Only healthcare professionals can provide you with medical advice. The instructions in this video are those issued by the health authorities of Quebec in Canada. These guidelines may be different in another province or country. We've invited Dr. Petraglia to speak to us, and all you will hear has been prepared by another physician called Nicole Audet. So let's start with the first question. Why is the COVID-19 called a pandemic?
You first have to know the difference between an epidemic and a pandemic. So an epidemic is a sudden and rapid sickness or disease outbreak in a given region, whereas a pandemic is an epidemic which will spread to another area and then to another one. So in the case of COVID-19, the pandemic is worldwide.
What are the names of the virus and the disease?
Well, the virus name is SARS-CoV-2. SARS, as we all know, means severe acute respiratory syndrome. This is something that happened in the past.
And why the number 2?
Well, it is the second coronavirus which causes severe lung disease in humans. As you remember, in 2003, the first one, the SARS-CoV, caused the SARS. There was no number 1 at that time because we didn't know that there would be a second one, so we didn't add the 1 to it. The name of the disease, COVID-19, is a composition of the first letters of the coronavirus disease, CO for corona, VI for virus, and D for disease, so COVID-19 is for the year of discovery of the virus, so COVID-19.
Makes sense. So what is a coronavirus?
Well, it's interesting because under an electronic microscope, coronaviruses, or CoV, they have crown-like spikes that protrude from their surfaces, as you can see on this photo. So you have the virus, and then you have little spikes on it.
Yeah.
The coronavirus, therefore, surface has very small spikes. And the SARS-CoV-2 is not the only human coronavirus, however. For example, the common cold is caused by another coronavirus, and it is with us.
So where can we find the SARS-CoV-2 in nature?
Well, in nature, the bat and the coronavirus will live together without difficulty. We know that. They are said to live in harmony. The coronavirus does not make the bat sick. To understand this harmony, you imagine a yogurt that contains bacteria which are bigger than the viruses. You can eat the yogurt safely because the bacteria in yogurt does not cause human disease. So the coronavirus and the bat live together without difficulty.
And how did SARS-CoV-2 pass from animal to human?
Well, as you know, we're still looking for the answer, but if we look at the recently published journals, for example, in 2020, the Journal of Nature published a study on this subject. We're very interested. We're trying to find out. So to understand, let's come back to the bat. As I just said, the bat and the coronavirus live in harmony. However, the virus cannot pass directly from the bat to humans. So the coronavirus may have passed through the mammal called pangolin, either through a bite or a direct contact with the bat. So the bat that contains the coronavirus may have given a bite to this mammal, which is called pangolin, and once in the pangolin, the coronavirus transforms itself. This phenomenon is called a mutation, as we know. And like the bat, the pangolin also lives in harmony with the new virus. When the humans eat the pangolin with this new mutated virus, the human becomes sick. And this phenomenon of disease transmission from animals to humans is called a zoonosis. So, in summary then, the coronavirus has moved from the bat to the pangolin. Once it got into the pangolin, the coronavirus has mutated And when humans eat the pangolin, they develop COVID-19. I remind you that this is not yet proven. However, it is the most likely hypothesis at the moment.
So, Doctor, I'm curious, what is a pangolin?
Well, a pangolin is a mammal, and I think if you look up it, it originates in Asia and Africa, but it is 1.5 feet or 1.5 meters or 5 feet long, and it can weigh up to 35 kilos or 77 pounds. So this is as big as 125 bats.
Wow.
And it's highly sought after for its meat, and its scales are used for medicinal purposes. So it is an endangered species. And although zoonosis is only a hypothesis, the authorities did not take any chance. They have prohibited hunting and eating of wild animals to avoid pandemics caused by all forms of zoonosis. Yeah.
Is this the first zoonosis that humanity experiences?
No, in fact, Jay, there was zoonosis in 2003, the SARS, which was caused by another virus from the coronavirus family. So in 2003, the bat passed the coronavirus to a wild animal called the civet. And humans ate the civet for its delicious meat, contracting the SARS-CoV virus. And in 2003, then, the authorities ended the SARS pandemic by banning the consumption and rearing of civets. Now, as this solution worked then with SARS, which was also caused by a coronavirus, the authorities hope it will work for the COVID-19.
I see. And this is still a hypothesis. We're not sure that it's the same thing with the pangolin.
Nothing is for certain yet, but it seems very plausible.
I see. So how does this coronavirus infect human cells?
Well, in 2020, at the University of Maryland, the researchers proved that coronaviruses can enter the human body through the nose, the mouth, and the eyes. And in fact, they have their spikes, which are located on their surface, which you saw from the previous figure, act as a key to enter the respiratory organ cells. So if you imagine a pangolin cell, the coronavirus spikes cannot enter their cells. Their spikes or keys don't work.
I see.
Yeah. However, in humans, it's different. The corona spikes, or what we will call their keys, work very well. When touching the surface of a human cell, the coronavirus spikes opens the door and gets into the cell. It enters the human cell.
I see.
The coronavirus will then replicate inside the cell, and each cell, imagine, can produce nearly 1 million viruses that spread throughout the body, causing COVID-19 disease after an incubation period. Yeah.
And what is an incubation period?
Well, there's been a lot of studies around that, but the incubation period is the time that elapsed between contamination of the individual and the onset of symptoms of the disease.
And how long is the incubation period for the COVID-19?
Well, for the COVID-19, the incubation period seems to be between 2 to 14 days, with an average of 5 days. So you get infected, you know, 2 to 14 days later, you show symptoms of the disease. You can show them at 5, you could show them at 9. Some studies show it's more, but that's about the average, which is accepted.
I see. And doctor, what are the symptoms of COVID-19 disease?
Well, the 3 most common symptoms, typical symptoms, are cough, fever, which is over 38 degrees Celsius, and a difficulty breathing. So some people with COVID-19 also complain of a decreased or a loss of sense of smell and a sense of taste. So your sense of smell and taste can also be affected, either decrease very much or a complete loss.
So what should a person who has these symptoms do?
Well, if you have a cough or fever or difficulty breathing, you don't go to the emergency room or a medical clinic. You do not go. What you do is you contact first the health authorities. There's a special line in our area. For example, in Quebec, it's 1-877-644-4545. You would call this designated line and you would tell them about your symptoms, and they will tell you where to go.
Okay.
Yeah.
And who are the people at risk of being severely ill?
Well, the people most at risk of being severely affected are people with an active cancer, for example, heart disease, people who have diabetes, people who have high blood pressure, and senior citizens. Yeah, those are the groups that are most affected, which is quite a large population.
Well, why are seniors more at risk than young people?
Well, it's very interesting because with age, the body's ability to defend itself well against infection will decrease. Okay? It's like the ability of elders to read. It decreases with age. With weakened defenses, the seniors are more at risk of developing a severe illness or dying than younger people are. And however, this does not exclude that everybody could contract the COVID-19. That's why the testing goes on. So, yeah.
What are the degrees of severity of the COVID-19 disease?
Well, it's interesting because the vast majority of patients have few or no symptoms, and unaware of their condition, they can actually transmit the disease. This is very interesting. The classic symptoms when somebody is affected are cough, fever above 38 degrees Celsius, as we mentioned, and difficulty breathing. There are some patients that also complain of muscle pain, fatigue, headache, and some people with COVID-19 complain of a brutal decrease in smell with or without a loss of taste. So finally, the most serious symptom is respiratory distress, which is caused by an inflammatory storm, which is exaggerated by the body's response to the virus, different than what we have when we have other ailments. So patients become very short of breath and find it difficult to breathe even at rest.
Why do some patients need an artificial respirator?
Some sick patients in intensive care are very short of breath, and they need an artificial respirator to help them breathe for a period varying between 10 to 20 days. And fortunately, the vast majority of patients recover. I think you saw the mad rush for respirators all through the United States and Canada.
Yeah.
And that was to prevent for the eventuality where a lot of people would have more of the respiratory distress symptoms than any of the others.
We hear about testing, and what is the screening test?
Well, there are several tests out there that I think you all heard about, but the screening test that we use is to take the sample, we insert a swab into the mouth and then into the nose. The swab is then sent to the laboratory for analysis. And after the test, however, you must isolate yourself at home while waiting for a call from your doctor to give you the result. Because, as you know, they just don't do tests on anybody. People have to qualify. So there's a chance that you might be infectious. Okay, so that's why you have to wait for the call. So if the test is non-reactive or negative, you do not have the disease. If the test is reactive or positive, you have the disease, and a public health official will ask you to identify everyone you have had close contact with.
Wouldn't it be better to test everybody?
Well, in principle, yes, it is. It would be better, but in practice, it is impossible as for all other tests. If we tested everybody, we'd have a shortage of testing materials. We don't have the personnel or the staff to administer and interpret, especially to administer the test. So the health authorities here have adopted a more effective strategy of targeting those most at risk, people who have symptoms, people, for example, healthcare workers and people returning from travel who have symptoms are the first ones to be tested.
What should travelers do when they return to their country?
Okay, well, as we've seen, travelers must stay at home in quarantine for a minimum of 14 days. And this is important to understand what a quarantine is.
Well, what may a person who is in quarantine do?
Well, if the health authorities have put you in quarantine, either because you are waiting for your test results, or because you have developed the disease, or for any other reason, stay at home for the duration of your quarantine. The key word is stay at home. And by following these instructions, you will avoid contaminating others, and actually you save lives.
Well, sure, doctor. May I do my groceries?
No, you may not do your groceries. You have it delivered. Or if you have someone who can deliver it to your door, a friend, somebody you could talk to on the phone. So you stay at home for the full duration of your quarantine.
Surely I may walk outside, no?
Well, no, you may not walk outside. I mean, that's the normal thing that we would think, but not really. So you stay at home for the full duration of your quarantine. You can go on your balcony to get fresh air, but
Okay.
that's about it.
Well, may I go out for a COVID-19 test?
Well, if they ask you to, if the health authorities give you an appointment for a COVID-19 test, you may go. This is the only exception. So, but, oftentimes 14 days passes quickly. You do not use public transport to go to your appointment.
Why everybody should stay at home?
Well, as we've seen repeatedly in the reports that they give us every day, the public health department, everybody has had to stay at home to flatten the contagion curve. So that's why we stay at home. Without this restriction, the number of cases would explode and exceed the capacity of the health system to treat all the cases, because that's one of the important issues, is once you go to a hospital, is there room for you? So the first curve illustrates what would happen if we did nothing at all. There would be so many sick people that we could not treat them all. In other words, there would be too many patients in hospitals for the number of beds, the number of artificial respirators, and the medical staff available. And the second curve illustrates the goal that we all give ourselves as a society. So if everyone collaborates by staying at home, there are fewer sick people in hospitals at the same time. It's more staggered. So everyone will be well cared for, and the number of deaths would be less. We will save lives.
What should people do to flatten this curve?
Well, Jay, it's interesting because there are a number of recommendations that have been put out, 5 recommended strategies. So to flatten the curve, we must avoid being piled up on top of each other like sardines, as we usually are.
Yeah.
And there are 5 recommended strategies to flatten the curve. Okay, so the first is, and the most important measure, is to stay at home as much as possible. Second, to respect social distancing at all times, and there's been definitions that are going around. Third, you cough in your elbow. You don't cough in your hands, because the hands can then transmit the disease to yourself or to others. So you cough in your elbow.
Uh-huh.
Fourth, after you blow your nose, it's important to throw away your tissues. So you throw them away in something plastic in a garbage. You don't put them back in your pocket and then reuse it. And the fifth would be to wash your hands for at least 20 seconds with lukewarm water and soap. Soap is important.
So why insist so much on the use of soap?
Well, because it's very interesting. The soap will defeat the fat, and the coronavirus membrane, the covering on the outside, is made up of fat. So the soap actually kills the virus, the coronavirus. This is important. Soap can be very useful.
Is antiseptic gel as effective as soap?
Yes, both are effective. Hand washing with soap and water, and the use of the antiseptic gel or hydroalcoholic solutions are among public health recommendations in Quebec. So for the antiseptic gel, it's important for you to check when you buy it. The minimum recommended alcohol concentration is 60%. On the internet, they're doing 50%. It's not good enough. It's 60% if you're going to use it to wash your hands.
Okay, and how to use antiseptic gel?
Well, the antiseptic gel should be used, to be effective, should be used on dry and ideally clean hands that are not very dirty, okay? So you avoid contact with the eyes after use because it does have alcohol. And the antiseptic gel should also be kept out of the reach of children. This is important now that children are around.
So just to be certain, you don't use antiseptic gel after you wash your hand with soap and water.
You don't need to because you've already inactivated or you've already killed the virus with soap and water. Okay? The antiseptic gel is something that you keep at other times when you don't have access to a sink with water and soap.
Okay.
Yeah. Yeah.
So is antiseptic gel essential for hand washing?
No, it's not essential. It is not essential. By washing your hands often with soap and water, you can easily do without these hard to find products because nowadays it's very difficult to find Purell or anything else. Yeah.
Okay.
Yeah.
How is coronavirus spreading between humans?
Well, there are 3 ways of spreading the coronavirus between humans that we know of. The first is through droplets that come from the nose or the mouth, through coughing, spitting, sneezing. Second, through direct human contact. And third, through indirect contact by touching surfaces where the virus has fallen. Okay, so let's look at the droplet way of spreading the disease, droplet that comes from the nose, mouth. So when the persons are infected, the coronavirus can be found in their saliva, for example.
Yeah.
When they talk to you or they cough, small droplets of saliva containing the virus are projected into the air and can land on you.
Okay.
So you can avoid being infected by droplets by keeping a distance. That's why the distancing is so important. So the distance that has been measured is 2 meters from others. So if you stay 2 meters away, you decrease the chance of that happening to you. So the second way of spreading the coronavirus is by close contact between 2 people. For example, if you shake hands with an infected person, which is something we all used to do, the virus will end up on your hand. And then when you touch your face with your hand, the coronavirus enters through the nose or through the mouth or through the eyes when you touch them. The third way of spreading the coronavirus is through indirect contact by touching surfaces around you. For example, and this is interesting, a contagious person coughs over a table and leaves viruses on it, and you touch the contaminated table. The virus will now be on your hand, and if you touch your face, your virus will enter your body. So it's very important, when they talk about cleaning surfaces.
Yes.
That's why, yeah.
But it must be different from each type of surfaces. How long can the coronavirus live, let's say, on porous or non-porous surfaces?
Yes, very interesting. So in March of 2020, researchers published the following results in the New England Journal of Medicine because this was a very big question. So they found that porous surfaces such as paper money, hair, wood, and fabrics don't allow the coronavirus to survive for long.
Okay.
Okay, so to explain this phenomenon, we look at a piece of tissue under a microscope. And under the microscope, you'll see that porous surfaces have little holes in them. Okay?
Okay.
They do not allow coronaviruses to survive for very long because these small holes can trap the virus and prevent its transfer. So, on the other hand, the coronavirus lives longer on non-porous surfaces such as door handles, tables, plastics. That's why they tell you that door handles are important to clean. So, if we compare the lifespan of coronavirus on cardboard, which is a porous material, and plastic, which is a non-porous material, researchers discovered that the coronavirus can actually survive 24 hours on cardboard, but 72 hours on plastics. So if you pick up something that's been infected without cleaning it, you can actually contract it.
Doctor, how to disinfect non-porous surfaces?
Well, to disinfect non-porous surfaces, Health Canada suggests a very simple and old method, which is using a bleach mixture. Okay, so we're talking about doorknobs and things like this. So in the Government of Quebec Self-Care Guide,
Yeah.
We suggest using 1 part of bleach for 9 parts of water, which means if you put 1 cup of bleach, you make yourself a solution. 1 cup of bleach, 9 cups of water. You put that in a spray bottle or in a bottle, and that's what you use. So, or you could also use alcohol, but it has to be at least 70% concentration, contrary to the hand one. So for the non-porous surfaces, you use 70% concentration, which will also kill the coronavirus. And we can also wash the non-porous surfaces with soap and water, by the way, because as we said, the soap will kill the virus.
Okay.
Yeah.
Is antiseptic gel for hands effective on non-porous surfaces?
Well, no, because as we said, the majority of antiseptic gels which we can buy only contain 60% alcohol, and you need at least 70% to disinfect a non-porous surface. So the antiseptic gel is a little bit softer, and it's reserved for hand washing. And if you want to, clean off a non-porous surface, then you use your 70% gel.
Is there any treatment for COVID-19?
Well, as you know, there's a real race around the clock that takes place and that's taking place around the world to find an effective treatment, and a lot of products are being suggested. So there's an army of investigators that are trying to find a solution. I don't think it'll be long because we have some very smart people working there. So since knowledge evolves very quickly, and the purpose of the video is to give you basic knowledge about the disease, any treatment I tell you about now may be different tomorrow, so in a month or in a year. So I prefer to abstain. But what I can tell you without a doubt is that the scientific community around the world is coming together to find drugs and a vaccine in the near future to build a wall between us and this disease. I think that there's a real race for drugs and vaccine right now. Mm-hmm. And it's a worldwide challenge, because it's a pandemic. So it's not like we're just working in Canada or the United States. Everywhere in the world they're working on this.
How can each person contribute to the global effort?
Well, it's important, and each individual can contribute to the global effort by respecting the instructions of the health authorities. As I have already said, you stay at home as much as possible, you respect social distancing, you cough in your elbow, you throw your tissues in a trash can, you wash your hands with lukewarm water and soap for at least 20 seconds. There are many videos that show you how to do it. Because, I repeat, soap kills coronaviruses. Yep.
What about masks? Are masks effective?
Well, wearing an anti-spray mask or a cloth scarf, there are many recipes as to how to make this masks even though you don't know how to sew. It's an additional measure to prevent the spread of COVID-19. However, it's important to know that it does not replace the measures already named, the social distancing, the washing of hands. So after you remove your mask, you wash your hands. So if you're wearing gloves, you remove your gloves, then you remove your mask, and then you wash your hands.
Great. So do you have any last advice for us?
Well, it's important for the health professionals to always tell the entire truth as best you can remember it. So when asked by a healthcare professional, avoid lying or not telling the whole truth about your travels, your symptoms, and the people you have been in close contact with, because it's important for them to know we must collaborate, and by telling the truth, you will save lives, and your own or those of the people who have intervened with you or those that you have seen.
I want people to understand that this is not just your opinion. Could you tell us the sources of the information cited in this video?
Yes, absolutely. So the information in the video comes from research by Dr. Audet on the websites of the Collège des médecins du Québec, College of Physicians of Quebec, la Fédération des médecins omnipraticiens du Québec, the FMOQ, and the Federation, la Fédération des médecins spécialistes du Québec, which is the FMSQ, the Quebec Public Health, and Health Canada, and also in the Self-Care Guide Quebec government. And in addition, the scientific reports published in the magazines of Nature and the New England Journal of Medicine.
We would like to give credits to our expert writer, Dr. Nicole Audet. You can reach her at drnicolebooks.com. Our producer, J.A. Gamache, reachable at jagamache.com. The illustrations were from Presenter Media and royalty-free illustrations. Our translator was Dr. Nicole Audet. The English narration was done by you, Dr. Teresa Petraglia. Thank you so much, Dr. Petraglia. So I'm sure that this will be very, very helpful. So thank you for taking the
I
time.
hope so. Yes, I hope so. Thank you. And I hope we'll be out of this soon.
Yes, we both do.
Yeah.
We all do.
Yeah, we all do.
Thank you.
Okay.